Daisy the dog is just about the only thing that can make Brendan get down on the floor for a cuddle. But sometimes it's hard for this pup to get this playful. After a bad fall, Daisy broke her leg, which eventually turned into arthritis.
We tried out different basic medications. She didn't like taking the medicine, different physical therapies. Pretty much everything they put in our hands, we put in this dog's body. But she just didn't like any of it, and it didn't seem to work. She seemed to still be in pain.
That was until they stumbled upon an alternative vet service and gave Daisy some Eastern medication.
You know what? After a few tries, we found acupuncture was right for us.
It's safer than you might think. Dr. Galina Burstein is able to explain how it works.
So basically with acupuncture, we use the same needles as we do for people. I'll just open one here. So you can see they're very fine. They're always stainless steel or carbon coated. They're not like regular needles, like some people think, oh my God, you're gonna just stick me with all these needles. But they're very, very fine. So it's actually designed to go through the tissue. A lot of times you can do a lot more with alternative treatments, whereas the Western options are gone. So there's nothing else, so you kind of have to look for other things.
Eastern and Western treatments are fundamentally different. In Western, you treat an illness, but Eastern tries to prevent them from even happening.
In Western medicine, a dog's diagnosed with arthritis, so the typical treatment is anti-inflammatories and some various forms of exercise, maybe a couple different supplements. With Chinese medicine, arthritis can be caused by different underlying issues.
So how are we going for walks now with her on the acupuncture?
It's me who doesn't want to walk most of the time.
Westernized medicine still plays a big role in treating pets, and it's continuing to grow. Hope is an elderly golden retriever. His owners didn't know how appropriate his name would be until after discovering a nasal tumor. Hope is being treated for his cancer by undergoing some radiation therapy.
He's just a very loving, sweet dog. He's a very good friend of mine. Very good friend of mine. So he's a wonderful boy.
The Platt family decided upon treating him in hopes to prolong his life and give it the best quality that they can.
It is very emotional, and my advice is seek help, and you'll be given options, and you pick the best option for you.
But first, Hope needs to finish his treatment, which is made possible by a number of doctors like Paul Woods.
There are a number of things we can do to, in some cases, cure the pet, but in many cases make their quality of life better. Sometimes what we can do is get them back to what they look like when they didn't have cancer, and we can get them right back to that level. Sometimes, though, it's more palliation, just giving pain management, things like that, to give the pet the best quality of life we can.
On the other side of the clinic, another furry friend is getting ready for chemotherapy. The team needs to make sure everything looks, feels, and sounds okay before Rudy can get his chemo.
Did you give him a treat?
I gave him 3.
Okay, good.
The nice thing about our chemotherapy, it's very similar to the chemotherapy we use in people. It's just not usually as intense. And so our goals are more quality of life, putting that pet, say a dog with lymphoma, into complete remission, meaning these big lymph nodes that were big and causing trouble now go back down to normal size. And as I mentioned, the dog, when they're in complete remission, their quality of life is just like they were when they didn't have the cancer.
The staff numbed the area where the needle goes in, so Rudy doesn't feel any pain. He only thinks if he lies down like this for a few minutes, he gets plenty of treats at the end. On the other side of the Ontario Vet College's campus, a team of researchers are trying to improve cancer treatments.
The idea is we develop therapies that would educate a patient's immune system to recognize their own cancerous cells as something that's dangerous and to kill off those dangerous cancer cells and leave the normal cells in the body unharmed.
The intensive therapies we're used to, like chemo and radiation, can be time-consuming and even span several years and hundreds of treatments. With new immunotherapies, it could be treated in as few as 2 or 3 tries. They've also partnered with the Terry Fox Foundation to fund research for bone cancer.
Our hope is that if we can develop an effective treatment for the dogs, we'll gain a lot more confidence translating that into a human clinical trial.
If your dog is totally healthy, you might not be thinking about the procedures available for it. But accidents do happen. That's why programs like the OVC's blood donor program is in operation.
Our products help patients who are, hit by a car, they've lost a lot of blood, they're maybe a cancer patient, or they're very anemic and just need some red blood cell replacement.
The clinic gives about 500 blood transfusions per year. Such success is only possible thanks to donors like Linda.
It's a win-win. I mean, the dogs get looked after. They get an annual. They get their liver and their kidneys and their blood all tested, and they're saving other dogs' lives, right?
The entire appointment takes around an hour, although donating the blood only takes a few minutes. The staff will help the dog on the table and numb the area around the needle. German Shepherds, like Roxy, are universal donors, like having type O blood in humans. But there are different blood types for different types of dogs.
Some dogs could have some skin irritation from the clipping and the prepping of the skin before we take their blood. And certainly it may not be for every dog's personality type, but generally there are no risks associated with giving blood.
Creating the right atmosphere is important to make sure the dog feels comfortable.
If it was hard to get her on the table, if she was shaking and I had to pull her, obviously I wouldn't keep her in the program. But luckily I've been fortunate that they both don't mind at all.
Fiona Robertson, Fanshawe Learns.